Sciatica is one of the most common pain complaints among adults over 60 in the United States. Some estimates suggest that up to 40% of people will experience sciatica at some point in their lifetime, and after age 60, the risk climbs because of natural changes in the spine, disc dehydration, narrowing of the spinal canal, arthritis building up around the vertebrae. All of these things can press on or irritate the sciatic nerve, which happens to be the longest and thickest nerve in your entire body. It runs from your lower spine, through your buttock, down the back of your thigh, and branches all the way into your foot. When that nerve gets pinched or inflamed, the pain can range from a dull, persistent ache to a searing, knife-like jolt that stops you mid-step. Some people feel numbness. Some feel tingling, like pins and needles dancing along the calf. Others describe a heavy, dead feeling in the leg that makes walking feel like dragging a sandbag. Here's what matters most. Sciatica does not have to be permanent, and you do not have to simply live with it. Relief is possible. Gentle, consistent movement is one of the most effective tools available, and research backs that up. So, let's get into the specifics. What to do, how to do it safely, and why each technique works. Before we move into the relief techniques, let's spend just a moment understanding the mechanics. Think of the sciatic nerve like a garden hose running beneath layers of muscle and bone. When everything is aligned and relaxed, water, or in this case, nerve signals, flows freely, no pain. But when a herniated disc bulges outward, or when the piriformis muscle deep in your buttock tightens and spasms, or when bone spurs narrow the channel where the nerve exits the spine, that hose gets kinked, signals misfire, inflammation builds, and your brain interprets all of it as pain, numbness, or weakness radiating down the leg. The beautiful thing is that many of these compressions respond remarkably well to gentle stretching, specific positioning, and mindful breathing, because when you release the muscular tension surrounding the nerve and encourage blood flow to the inflamed area, the body's own healing mechanisms kick in faster than most people expect. Now, a quick but important note. If you are experiencing loss of bladder or bowel control, sudden severe weakness in both legs, or numbness in the groin area, those are signs of a rare but serious condition called cauda equina syndrome, and you should seek emergency medical attention immediately. For the vast majority of sciatica sufferers, however, the following techniques are safe and effective. Let's start with what physical therapists often call the single best stretch for sciatic relief, the reclined pigeon pose, modified for seniors. Here's how you do it. Lie on your back on a firm surface. A yoga mat on the floor works, or even your bed if getting down to the floor is difficult. Bend both knees so your feet are flat. Now, take the ankle of your affected side, the leg where you feel the pain, and cross it over the opposite knee so your legs form a figure 4 shape. Gently reach both hands behind the thigh of the bottom leg and pull it toward your chest. You should feel a deep but tolerable stretch in the buttock of the crossed leg. That stretch is targeting the piriformis muscle, which sits directly over the sciatic nerve. Hold this position for 30 seconds. Breathe slowly, in through the nose, out through the mouth. With each exhale, allow your muscles to soften just a little more. Then release, rest for 10 seconds, and repeat 2 more times. Many seniors tell me they feel a noticeable difference after the very first hold. The key is gentleness. You are not trying to force anything. You are inviting the muscle to release, not demanding it. This next movement is beautifully simple and works by creating space between the vertebrae in your lower spine, which takes pressure off the nerve root. Remain on your back. Bring one knee toward your chest, again, the side where the pain lives, and clasp your hands just below the kneecap. Pull gently until you feel a mild stretch in your lower back. Your opposite leg can remain bent with the foot flat or extended straight, whichever feels more comfortable. Hold for 20 to 30 seconds. Breathe deeply. You might hear a soft pop or feel a subtle release in the lumbar region. That's normal. That's decompression happening in real time. Now here's a variation that adds extra relief. While holding the knee to your chest, make small, slow circles with the knee, tiny rotations no bigger than a tennis ball. This mobilizes the sacroiliac joint and massages the deep muscles of the lower back. 5 circles clockwise, 5 counterclockwise. Then switch legs and repeat even if the other side doesn't hurt, because maintaining symmetry protects you from future flare-ups. Have you ever heard of nerve flossing? It sounds strange, but the concept is straightforward. Just as you floss between teeth to keep them healthy, you can gently glide a nerve through its surrounding tissue to reduce adhesions and calm irritation. Sit in a sturdy chair with both feet flat on the ground. Straighten the affected leg out in front of you while simultaneously tilting your head back to look at the ceiling. Then bend the knee back down while tucking your chin to your chest. Alternate between these two positions in a slow, rhythmic pumping motion. Leg extends and head goes back, leg bends and chin tucks down. Perform 10 repetitions. The movement should be smooth, almost wave-like. You might feel a mild pulling sensation along the back of the leg. That's the nerve gliding through its sheath. If you feel sharp pain, reduce the range of motion. Don't extend the leg quite as far, or don't tilt the head as much. The goal is a gentle tug, never a spike. This technique is especially helpful for seniors who feel that their sciatica worsens after sitting for long periods, say during a car ride or while watching television. The nerve glide reestablishes healthy movement patterns and reminds the nerve that sliding through tissue is safe and normal. Not everyone can get down to the floor, and that's perfectly fine. This technique is done standing, with one hand on a wall or countertop for balance. Stand with your feet shoulder width apart. Identify which side hurts. If the pain is on your right side, shift your hips to the right, push them laterally, as though you're trying to bump open a door with your hip. Hold that shifted position for 5 seconds, then return to center. Repeat 10 times. What this does is remarkable. For many people with sciatica caused by a disc bulge, the disc tends to push toward the nerve. By shifting your hips in the opposite direction, you're mechanically encouraging the disc material to migrate away from the nerve root. Physical therapists call this a lateral shift correction, and it's a cornerstone of the Mackenzie method, one of the most evidence-based approaches to back and leg pain in the world. If shifting toward the painful side increases your symptoms, try shifting away from it instead. Everyone's anatomy is slightly different, so listen to your body. The direction that reduces your leg pain, even if it temporarily increases back pain slightly, is usually the correct direction. If you're over 60, or if you're caring for an elderly parent, spouse, or friend who struggles with this kind of nerve pain, this information could genuinely change their daily quality of life. Consider sharing this video with them. Sometimes all it takes is one person passing along the right knowledge at the right time. And if you're finding this helpful, tap that subscribe button so you don't miss future videos. We release senior health content every single week, covering everything from joint pain to heart health to sleep improvement, all tailored specifically for bodies over 60. This final technique combines gentle strengthening with deep breathing, which research shows can actually reduce nerve pain by calming the sympathetic nervous system, the part of your brain responsible for amplifying pain signals when you're stressed or tense. Lie on your back with knees bent, feet flat, and hip width apart, arms resting at your sides. On a slow inhale, press through your heels and lift your hips toward the ceiling. You don't need to go high, just enough to form a gentle slope from your knees to your shoulders. At the top, squeeze your glutes lightly and hold for 3 seconds while continuing to breathe. Then exhale slowly as you lower your hips back down one vertebra at a time, like a string of pearls settling onto a table. Perform 8 to 10 repetitions. The bridge strengthens the gluteus maximus, which when weak forces the piriformis to overwork, and an overworked piriformis compresses the sciatic nerve. By building glute strength, you're addressing one of the root causes, not just the symptom. If lifting your hips feels too intense, place a firm pillow or a rolled towel under your sacrum, the flat bone at the base of your spine, and simply rest there in a supported bridge for 60 seconds, breathing deeply. The gentle extension opens the front of the hip and decompresses the lumbar spine without requiring any muscular effort at all. Relief in the moment is wonderful, but prevention is where lasting freedom lives. Let me share a few daily habits that dramatically reduce sciatica recurrence in seniors. First, avoid prolonged sitting. The discs in your spine absorb more pressure when you sit than when you stand or walk. If you're watching a show, reading a book, or working at a desk, set a gentle timer to stand and move for 2 minutes every 30 to 45 minutes. Even a short walk to the kitchen and back resets the pressure equation in your lower back. Second, sleep with a pillow between your knees if you're a side sleeper, or under your knees if you sleep on your back. This maintains neutral spinal alignment through the night and prevents the pelvis from rotating in a way that tugs on the sciatic nerve while you're unconscious and unable to adjust. Third, stay hydrated. Your spinal discs are roughly 80% water. When you're dehydrated, which happens more easily as we age because thirst signals diminish, those discs lose plumpness, flatten, and are more likely to bulge into nerve territory. Aim for 6 to 8 glasses of water daily, more if you're active or in warm weather. Fourth, wear supportive shoes. Flat, worn-out soles alter your gait, which travels up the kinetic chain and affects pelvic alignment and lumbar loading. You don't need expensive orthopedic footwear, just shoes with a cushioned sole and decent arch support. Fifth, mind your weight. Every additional pound of body weight adds roughly 4 pounds of pressure to the lumbar spine. Even a modest reduction of 10 or 15 pounds can make a meaningful difference in nerve compression. Most sciatica improves significantly within 4 to 6 weeks with conservative care, stretching, movement, anti-inflammatory strategies, and patience. But there are moments when professional evaluation becomes important. See your doctor if the pain has persisted beyond 6 weeks without improvement. See your doctor if you notice progressive weakness, your foot drops when you walk, or you can't rise onto your toes. See your doctor if the pain began after a fall or trauma. And as I mentioned earlier, any changes in bladder or bowel function warrant an immediate emergency room visit. Your physician may recommend imaging, an MRI or CT scan, to visualize exactly what's compressing the nerve. From there, treatment options range from physical therapy and targeted injections to, in rare cases, minimally invasive surgery. But the vast majority of seniors never need surgery. The body has a remarkable capacity to heal when given the right conditions. I want to acknowledge something that doesn't get discussed enough. Living with sciatica doesn't just hurt your body. It changes your mood. It steals your confidence. It makes you hesitate before accepting an invitation, before playing with grandchildren, before taking a walk with your spouse on a beautiful evening. Many seniors I hear from describe feeling isolated by their pain, like they've become smaller versions of themselves. If that resonates with you, please know you are not weak for hurting, and you are not a burden for needing help. Pain is a signal, not a sentence, and every small action you take, every stretch, every mindful breath, every glass of water is an act of reclaiming your life. You deserve to move without fear. You deserve mornings where standing up from bed doesn't feel like a negotiation with your own spine, and those mornings are achievable. Let's quickly recap what we covered today. 5 techniques for sciatica relief that take just minutes. The reclined pigeon stretches to release the piriformis muscle. The knee-to-chest decompression to create space in the lumbar spine. The seated nerve glides to free adhesions along the sciatic pathway. The standing hip shifts to encourage disc migration away from the nerve. And the supported bridge with breath work to strengthen the glutes and calm the nervous system. Combined with daily habits, moving frequently, sleeping with proper support, staying hydrated, wearing good shoes, and maintaining a healthy weight, these tools form a comprehensive, gentle approach to managing and preventing sciatica. Start with one technique today, just one. Give your body 5 minutes of attention and kindness. Tomorrow, try another. Build slowly. Consistency always outperforms intensity, especially for bodies that have earned their years. If this video helped you, hit that like button. It tells the algorithm to share this with other seniors who need it. Subscribe to this channel for weekly health tips designed specifically for adults over 60, and drop a comment below. Tell me which technique worked best for you or share your own sciatica story. Your experience might be exactly what another viewer needs to hear today. If someone you love is dealing with back or leg pain, send them this video. Sometimes the greatest gift is simply saying, I found something that might help. Take care of yourselves. You've earned every good day ahead of you. Now, let's make sure your body cooperates. I'll see you in the next one.